A really common question that people have when it comes to lasers is what wavelength or color of laser is the best? And does it really make any kind of a difference? And if you've been wondering about that, is there a difference between a violet, a green, a red, an infrared, or a far infrared? Then this video is going to help answer those questions for you. So we're going to jump in and we're going to start really diving into how each wavelength is different and what are some of the specific reactions that can occur when you have a laser of a different wavelength on here. And this is important for you to understand. We ask the question, which wavelength or device is best? And really, it breaks down to it depends on the condition. Each wavelength affects the electron transport chain protein complexes differently and produces a wavelength-specific unique photochemical effect. Then each wavelength has a specific photon energy, which is electron volts or EV. And certain EV energies are required to trigger specific reactions. So my name is Dr. Kurt Gair, and welcome to episode 1 of my Laser Health Revolutions, where we answer many of the common questions with laser therapy and light therapy. And this one comes up quite a bit. So when we look at laser therapy and light therapy, there's a lot of confusion that's out there. There's a lot of misinformation, many times spread by supposed experts who say they've been doing it a long time, who oftentimes are really sales reps for certain types of devices. And so they're promoting a certain type of an agenda. I've been using lasers since 2004, so I have more than 2 decades of experience with this. And one of the doctors who trained me had been using since the 1980s. And with that in mind, many people think that these therapies are new, but realistically, it goes back decades. By 1974, many people don't know, but the former Soviet Union had laser therapy as part of its state-sponsored, standardized medical treatment for many, many different conditions. Things that here in the West we still consider being off limits. Things like even for chemotherapy, they'd use it to regenerate liver tissue, pancreatic tissue, thyroid tissue. They're using it on kids, on pregnant women, all this different stuff. And I don't want you to take my word for it. Fact check me for sure, but do it in the legit way, not the Facebook fact checker way. Go onto PubMed and read for yourself what it says about laser. And this is one particularly good researcher named Sergei Moskovin, and he is a Russian researcher. And what I want to share with him is he talks about how you use different wavelength of lasers differently. So there's a misconception that all wavelengths have to be used in the same way. I'm going to show you there's a cutoff point at 730 nanometers where we shift from the visible wavelength lasers, which are very high energy, versus the low energy infrared lasers, and those ones are used differently. And this is where Moskovin talked about that. He said in Russia, if they were going to treat bronchial asthma and they're using a high energy wavelength like a red, which is above a specific threshold we'll get over to discussing later of 1.7 electron volts, you can use these ones over large blood vessels, like over the subclavian artery, to get the energy directed into the lungs to help a patient with bronchial asthma. But he talked about if you're going to use an infrared wavelength like 800 nanometers and longer, that tend to be higher wattage, higher power devices, you've got to go directly over that tissue because those ones operate mostly by creating a thermal and a mechanical vibratory effect on the tissues. Versus what I'm going to talk a lot about today are the misunderstood high energy wavelengths that trigger photochemical and photoelectric and photosignaling reactions. And they can be used at places distal from where you're trying to treat. And you can use this through the circulatory system too. And this is what Moskovin was talking about, is that you can use these things differently. So I want you to keep that in mind, that if you're used to like a class 4 high power laser, I'm not saying that those don't work and that only these work. I'm just saying they work differently. You utilize them different for different types of conditions. And when we look at this specifically here, this is important to understand. These high energy, low power, which is the low milliwatts class 2 visible wavelength lasers, say from 405 nanometers to 730, which is from violet, green, and red, can be used differently. And with lower power, you don't have to use the high power wattage that you have to with, say, like an infrared device that has that low energy. Very critical to understand that. And here's one of the things that to understand here. When we're looking at these high energy visible wavelengths, like I have been using Erconia lasers since 2004. I didn't start teaching or researching for them until 2017, so I had 13 years under my belt as just a practitioner, seeing the results in my office with patients. You can do these over the large blood vessels to go globally. They'll also propagate through the microtubules. Now, you may have thought of microtubules as just being for the shape of a cell, but if you go into PubMed, you'll find out that current research is suggesting they can be used kind of like a fiber optic network to transmit ultra weak biophotons and laser signals throughout the body. Same thing with myelin sheaths. We've always understood those as being insulation for nerves. There's current research suggesting that it can transport these light impulses as well. Deep in the brain, we have photoreceptors, and that's because the brain is sending these different types of light impulses, these ultra weak biophotons. Go onto PubMed, read about those for yourself. We don't have time to get into that here, but this can also propagate through the water content of the body, which we know that it's 92% in the blood, 75% in muscle, and 73% in the brain. And these high energy wavelengths do it without creating a thermal impact. They trigger these photoelectric and photochemical signaling events that make electrons jump into a higher orbit to trigger hundreds of thousands of reactions from a single photon, which is different than the way the infrared devices work. So if you're a layperson listening to that, or also for a doctor, here's the easiest way to understand it. When I have a patient in front of me and they ask me, well, what's the difference between that violet laser you're using or a green one or a red one or an infrared, is let's consider this. Let's say that you go into a UV tanning bed, and let's say that then later on you go into an infrared sauna. Can you get the same reactions in the body from each of these? The answer is no. You're going to get very different wavelength-specific, color-specific reactions. So, for example, if you're going to go into the UV tanning bed over there on the left, you're going to trigger melanin production for a nice suntan. You're also going to trigger the production of vitamin D. And this is where things get really crazy, because you will see people mistakenly say, oh, a violet wavelength laser can only affect the upper level of the skin. It has no impact on anything deeper. Well, let me ask you this. If an ultraviolet wavelength penetrates a couple of microns, yet it can trigger vitamin D, and how deep does that vitamin D go? We know that that can go systemically throughout the body to dampen inflammation, modulate the immune system, and most importantly, support healthy bone formation on here, all with just having exposure to UV types of rays. Now, if we go over here to the right side and we've got that infrared type of a light, infrared type of a sauna, we get some different awesome things that occur. But no matter how high you crank up that infrared device, all you're going to get is more of a dose of these infrared photons. You're going to get a heating effect. You will never ever produce melanin. You will never ever produce vitamin D. That's an important thing, because there's a lot of misconceptions out there that people say, well, I can take my infrared laser and do exactly the same thing you did with a violet or a green or a red. And you cannot, because there are wavelength specific reactions. There's another example that's very easy to understand is, let's say you've got a baby that's born in the hospital and it's got jaundice. If they have jaundice, what do they put them under? They put them under a blue light. This triggers a bunch of photochemical reactions that then supports the liver, so that way the baby is no longer jaundiced. They don't stick them under a green light or a red light or an infrared lamp, because none of those will create the wavelength specific reaction. That's critical for you to understand, that there are certain reactions that occur with certain wavelengths. As a matter of fact, back during the COVID pandemic, there were studies that came out that showed that 405 nanometer lasers, which are actually, this calls it blue light, but 405 nanometers is actually violet light. There's a lot of naming of these wavelengths in PubMed, unfortunately. And the reason why I want to differentiate that is because the blue light is more in the 470 plus or minus nanometers. And that can have some impacts on your sleep-wake cycles that we don't have with the violet. So you're not going to have to worry about the violet like creating a problem that blue light might. But at 405 nanometers, it has these wonderful antimicrobial, antiviral properties. As a matter of fact, the Erconia lasers that I utilized were the first ones to get an FDA clearance for a laser for nail fungus, and they also got clearances for the bacteria that causes acne. And if you go into PubMed, you can see these studies showing that these lasers applied to the body can help the immune system neutralize COVID-19. There's studies showing a 92% effectiveness versus MRSA in the body. So a lot of cool things that happen with the violet that you get to a higher level than you would with, say, a green or a red or an infrared. So it's unique things. Not saying they can't occur to some extent with the other ones, but you get the biggest support for the immune system with a violet laser. It has the highest electron voltage of 3.1 electron volts. This is why I love using this laser to also help break down scar tissue. So when I'm dealing with an athlete who's got a lot of scar tissue, we'll utilize that wavelength laser too for this. Now, again, don't take my word for it. Let's look at what some well-recognized sources are saying about this. So, one of the books over here, Laser Phototherapy, which now, if you do a Google search on it, you can find free PDFs on it because the book is out of print. So, there's some people who have uploaded it for you to be able to check out all the data that's in there. It's by Lars Hode and Jan Turner. And in it, they talk about this in 2014. They said that visible and infrared wavelengths of laser and light affect biostimulation in different ways. The visible light, violet, green, and red, elicits photochemical changes, while infrared, going from 800 to around 1064, can only produce physical changes like thermal and mechanical changes. Stanford University, doing their research on it, said that visible light, green, violet, red, can produce photochemistry. Infrared radiation only produces molecular rotations and vibrations. They are different. Lastly, over here, this is another paper that said that if you're utilizing 635 nanometer laser, which is red, it's been shown to produce a significant upregulation of nitric oxide, whereas other wavelengths like 785, 808, and 905 were not significantly different than the control group. So that's even if you crank up the power, crank up the wattage, you still don't see that change. And their conclusion was they said, considering the low quantum energy per photon for the infrared ones, which is equal down at only 1.52 to 1.37 electron volts, they apparently do not induce direct photochemistry, as the minimum quantum energy is on the order of 1.7 electron volts to trigger a reaction, and they don't have it. That's a key thing here. So what I want you to understand is that the visible wavelength lasers we're talking about really behave more in a quantum mechanics type of a manner, whereas the infrared is more Newtonian. And again, I'm not to knock one, we're just saying they're different. And the key thing for you to understand, because there's a big misconception where people think you've got to put a high dose in there to trigger a reaction. Stanford University again said that in principle, let me slide this over. In principle, one photon can activate one enzyme molecule, which in turn can process many thousands of substrate molecules. And if the effect of one photon can be amplified biologically, then you don't need a lot of photons to produce an effect. You just need to find the proper wavelength of light to stimulate the proper enzyme, which in turn will stimulate the beneficial therapeutic effect. So when I'm using my Erconia handhelds, we're getting around over a quadrillion photons per second is coming out of that laser. So you figure if there's a quadrillion photons and each photon can trigger hundreds to thousands of reactions per photon, and you're getting that per second, you're getting quadrillions of reactions per second that's occurring with that particular device. So that's why we can do things without having to do real high dosage, because we're looking at the reactions that we're trying to trigger to occur. So like a 5-minute session, you're going to get about 300 quadrillion photons, which is a lot, especially when we consider this. When we look at this is in Science News, it stated that one photon is all it takes to kick off photosynthesis. That gets the ball rolling, and you trigger these reactions that can kind of be like an avalanche as they get rolling and get going along. To really break it down, this is my summary slide over here. Let me just move this. So when we look at an infrared laser, they're more Newtonian. So these ones behave in a more Newtonian physics model. You do it on larger structures. It's photothermal or mechanical. Patients like that they can feel the thermal impact of it. Doctors also like that. Since it's a very high dose that's coming out, you get what's called bioinhibition. The bioinhibition causes a very quick reduction in pain. Many doctors and patients like that because you get a very quick pain relief on that. The one trick there is the bioinhibition. The higher you put that dosage, that can also slow down some tissue repair. Again, don't take my word for it. Go onto PubMed, read about it, read the Turner and Hode book as well too, and you'll see them talk about the research papers on that there's a sweet spot of the dosage that you don't want to go too high, otherwise you get a negative feedback and you can start to trigger some inflammation. They operate with high watts or a high dose to make up for the low energy. So when you hear power, when you hear like these things are coming at 1 watt, 10 watts, 60, 240 watts, that just means you're doing a mega dose. That's like taking a mega dose of a supplement, a mega dose of a medication on there. It's not meaning that that ever changes the energy of that particular wavelength, just you're getting more of these low energy photons. You really more need direct penetration for those effects on there. The cutoff again is 730 nanometers. So everything that's infrared is longer than that, has a higher number. Higher numbers means less energy. On the left, these are the visible lasers, the violet, the green, the red. They work more in a quantum physics model because what they're really working on is the electrons, which the electron's the smallest particle there that exists in a theoretical space, and the energy from the laser comes in and causes these electrons to jump into higher orbits and trigger a bunch of reactions here. They trigger photochemical reactions, photosignaling reactions. They stimulate the production of your body's own ultra-weak biophotons, which then are thought to contain qubits of data. So it's triggering cell-to-cell communication and has this spooky global action. So we see the infrared have lower electron voltage, whereas the visible lasers have a higher voltage. You think of it in terms of like AC/DC. We got high voltage coming in here, and that's the difference. You got high voltage of this above 1.7 electron volts to trigger electrons to jump, or you have lower voltage and high power, which is high dose. That's really the difference in here. Why is that 1.7 electron volts important? Well, here's why it's required in order to create these photochemical reactions. So I like to talk about in terms of a beloved movie, Back to the Future. Remember Doc Brown would talk to Marty and he said, Marty, when this baby hits 88 miles per hour, you're going to see some serious shit. And then the DeLorean hits 88 miles per hour and it's able to jump back in time. Well, it's a similar thing when we're talking about lasers and we're talking about these wavelengths. And if we can get these lasers to go above 1.7 electron volts, which is red is 1.9, green is 2.4, and violet is 3.1, you can, in the words of Doc Brown, see some serious shit. And that's the thing here, is think of it in terms of a DeLorean. That DeLorean had to hit 88 miles per hour to have the energy to jump back in time or get back to the future. If you did 10 DeLoreans at 87.9, 100, 1,000, 10,000, 100,000, or a million at 87.9, none of them have sufficient energy to jump back in time. That is like taking an infrared laser or an infrared lamp and cranking up the power to pump out more wattage. That's more DeLoreans coming at you. They all are below the threshold to trigger an electron jump. You have to hit that 88 miles per hour to make the car jump back in time, and it just takes one DeLorean for Marty to get back to the future. Same thing, it just takes that one electron to be above 1.7 electron volts to trigger the photochemical cascade that Stanford said can trigger hundreds to thousands of reactions. And this is showing you the spectrum here. So think about if you go out to the far, far left, you've got gamma radiation. That if you take a few gamma photons that are high enough to rip your DNA to shreds, and within a few weeks, couple of weeks, you're dead. Then you've got the X-rays that aren't as lethal, but they're powerful enough to ionize the electrons and to make things break apart if you get too much of a dosage of it. Then you got ultraviolet that you can trigger the melanin reaction, you can trigger the vitamin D reaction here, and then violet is the next powerful, but it's not ionizing, so you don't have to worry about creating some damage from these types of photons in here. But it's enough to trigger reactions. Violet, green, and red do that. Infrared, you see, falls below that threshold of 1.7. That's down at 1.5 electron volts, and it gets lower as you head over to the right. So different reactions are occurring in there. You need that minimum of 1.7 to cause the electrons to jump. Those are your cutoffs there. Again, don't take it from me. Go look at this book on here. They're going to talk about all the research. The bulk of the research on laser therapy is for class 2 and class 3. You will see a lot of people that kind of misrepresent the data and try to say that the class 4 ones are the most well-documented, researched. Go on to PubMed, you'll see that's not the case. When we look at FDA clearances, majority of the FDA clearances are for specifically to the zirconia lasers. There's 22 currently as I'm doing this video. They own 22 of the 25 FDA clearances. Those are based on level 1 randomized placebo-controlled studies that are versus red light. So if someone tries to tell you red light is just as effective as an zirconia laser, it is just not true. When we've done the randomized placebo-controlled studies, double-blinded and quadruple-blinded, the laser outperforms a red light device by usually 6 to 7 times on there. So that's important to understand. But go and research this stuff in this book, 135 pages of research references, thousands of studies. The bulk of them are below 500 milliwatts, which is class 2 or class 3. So it's important to understand that. So one of the things as we're coming to the end here that I want to kind of part you with is to understand when it comes to your mitochondria. A lot of people talk about laser impacts on mitochondria and complex 4 of the electron transport chain. So red and infrared can impact that. They do it in different ways. Red does it in a photochemical type of way. Infrared does it by creating these molecular rotations and vibrations. But they can help with the end stage of producing ATP. Where you have wavelength specific reactions that red and infrared don't really have that big of an impact, it's a very small impact, is that complexes 1, 2, and 3. The first two steps, and you think about this, an electron has to move along from step 1 to step 2 to 3 to 4 to finally make more ATP, more energy. And we have things that will disrupt the electron transport chain. And at steps 1 and 2, violet is the specific wavelength that helps with complex 1 and 2. Green helps with 3, and red helps with complex 4. Why do we care about what goes on with the mitochondria? Well, we're seeing in the post-COVID world that there's a lot of trouble with mitochondrial dysfunction. And here's some of the symptoms people will have: skeletal muscle movement disorders, metabolic disorders and diabetes, mitochondrial diseases, cancers, cardiac diseases, neurodegenerative ones, pulmonary and respiratory, vascular diseases and atherosclerosis, advanced aging, dystrophies, renal diseases, neurological disorders, and autism. So if you can support the mitochondrial function, you can have an impact on all of these different types of conditions to provide support for them. So obviously there's a lot of nutritional things that you can do to support your mitochondria, but if you want to support all of these steps in the mitochondria, I like to use all 3 wavelengths on a patient. The violet to support the first 2 steps, the green to support step 3, and the red to support step 4. And here's why. If we look at in the US, these are some of the top 20 medications. Take a look on here and how many people are on Lipitor or metformin or acetaminophen, hydrocodone, or even aspirin or metoprolol. These things will all negatively impact complex 1 and 2. This is why I like to use a violet wavelength laser to provide support to these patients. When we look at what impacts complex 3 negatively, again, some of these same medications, but also dexamethasone, erythromycin, gabapentin, Lipitor. So I like to use green on these patients. But where you really see a lot of patients getting messed up is with all these common things in their lifestyle. So if people are exposed to things like glyphosate, Roundup, artificial sweeteners and colors, if they're high fructose corn syrup, common pesticides and herbicides, if they vape or smoke, if they eat hydrogenated vegetable oils, if they're exposed to the COVID spike protein, or they drink alcohol, this can impact complexes 1, 2, and 3. So again, I like to not only provide them with nutritional support, supplements, but I like to get all 3 of these laser wavelengths on them to help support their mitochondria. And this is just rounding things out. We're seeing like Arconia has done a great study on utilizing red lasers for autism, which is fantastic. Using red lasers, some people use infrared lasers. But what's missing out is that we look at this, 60% of kids have problems with complex 1 and 2, 40% have problems with complex 3. So if you don't have violet and green, you kind of miss out on a couple of things there. Similarly here, when we look at long COVID and mitochondrial dysfunction, there's a lot of links between that. We'll get into that in a later episode. There's not enough time to get into that here. We look at osteoarthritis. There is a role of mitochondria in that, and complexes 1, 2, and 3 are involved when mitochondria is not functioning optimally. So again, this is where getting this violet and green laser on there can provide a lot of help and support for these patients. We're looking at different neurodegenerative diseases. We'll get into a module fully on, or an episode fully just on neurodegenerative diseases. We look like Alzheimer's, complex 1, 3, and 4 involved. Parkinson's, it's complexes 1 and 4. Huntington's, complexes 2, 3, and 4. And ALS is all of them. So again, this is why, you get some great stuff with a red, or say some people love an infrared, but if we can get all 3 of these wavelengths, we can hit all these different pathways that can be involved with these different types of conditions. Similarly here, this was a study done at the University of Chicago in Illinois with utilizing red, green, and violet lasers, showing benefits with patients with renal fibrosis. We'll do a whole episode on that later. There's also another study showing these benefits for actually triggering the repair of the disc of annulus fibers by stimulating extracellular matrix modifying enzymes. So again, kind of summarizing here, the violet helps with complexes 1 and 2, green complex 3, red complex 4. And the violet is best for antimicrobial support. Not saying the others don't do it, but this one has the biggest impact. Scar tissue breakdown, stimulation of vascular endothelial growth factor, sympathetic and parasympathetic balance, and to decrease interleukin 6, that nasty inflammatory cytokine there. Green is really best for stimulating collagen production and elastin and chondrocytes, stem cells. There's some preliminary studies right now that are suggesting it's superior for bone and nerve regeneration compared to some red and infrared wavelengths. And red is the best in that final step in the energy chain of the mitochondria at complex 4. It helps support interleukin 10, also T regulatory cells. Great again for sympathetic and parasympathetic support, especially when paired with violet. Helps with cell proliferation and decreasing prostaglandin E2. So I like to use all three to get the biggest impact. This is the study. Everything I talk about is supported by studies, and there's studies that are actually on the same wavelengths that we use here at Erconia. So to finish here, be sure you like my YouTube page here and subscribe to it. Also, you're welcome to join my Facebook group, Dr. Gair's Laser Therapy Treatment and Marketing Secrets. Again, this is episode 1 of the revamping of my YouTube channel. I did this because so many doctors have asked for more episodes on different things, and I thought this is a great episode to start with. So be sure to like and subscribe and to catch the next episode coming up.